Hello there. Ever wondered about iron deficiency anemia and its treatment? Well, today we're going to delve into that. Iron deficiency anemia is a common type of anemia that occurs when your blood lacks adequate healthy red blood cells. But don't fret, it's a condition that can be treated, and we're here to explain how. The treatment process for iron deficiency anemia involves several steps. The first one is quite straightforward: increasing iron intake. Adults, whether pregnant or not, should take elemental iron ranging from 100 to 200 milligrams per day. For children, the dosage should be 3 to 6 milligrams per kilogram per day. Several forms of iron are available, including ferrous sulfate, ferrous gluconate, and ferrous fumarate. These should be taken on an empty stomach, 1 hour before meals. However, it's important to note that about 1/4 of patients will experience constipation. In these cases, a stool softener may be considered alongside the iron intake. Another key point to remember is that medications that reduce gastric acid secretion, such as proton pump inhibitors and H2 antagonists, tend to reduce iron absorption. In this case, special oral iron formulations and compounds may be used, although they tend to be more expensive. Intravenous iron, which is dextran-free, is another option for patients who cannot tolerate oral replacement, or for those who do not sufficiently respond to oral replacement. Liquid iron preparations, which are usually used for children, can also be used in adults when tablets are not absorbed or when low tolerance requires a dose reduction. What if the treatment doesn't seem to be working? Well, continued bleeding and untreated hypothyroidism could be potential causes for the failure to respond to iron. As for how much elemental iron is needed, a formula can be used. It factors in the desired and observed hemoglobin levels and lean body weight. Now, what about those who can't take oral iron? There are relative contraindications for oral iron, including tetracycline, allopurinol, antacids, penicillamine, fluoroquinolones, and vitamin E. In these cases, parenteral iron may be considered, especially for patients with hemoglobin levels less than 6 grams per deciliter, malabsorption, chronic kidney disease, or failure to respond to higher oral doses with concomitant vitamin C. It's worth noting that iron may cause dark stools and constipation. Also, an iron overdose is highly toxic, so keep tablets and liquids out of reach of small children. Lastly, in case of severe acute blood loss or severely symptomatic patients, a blood transfusion may be necessary. The hemoglobin threshold varies by risk factors and clinical scenarios. For instance, pregnant women with hemoglobin less than 6 should be transfused. And there you have it, the step-by-step treatment process for iron deficiency anemia. Remember, it's always crucial to follow a healthcare professional's advice when it comes to treatment. This video is simply to provide you with a better understanding of the process. Stay healthy, stay informed.